Mary is a 36-year-old woman with a previous history of tuberculosis. She complains of fatigue, weight loss, and vomiting. Mary states that she has not been able to accomplish activities of daily life without these symptoms. Noticing the areas of hyperpigmentation, you suspect that Mary has Addison's disease. Addison's disease is a chronic metabolic disorder that requires lifetime hormone replacement therapy. It is a disorder that occurs when the body does not produce sufficient amounts of certain hormones produced by your adrenal glands. Addison's disease is an autoimmune disease because it results from a malfunctioning immune system that is attacking the adrenal glands. Normal physiology. The adrenal glands are situated on top of the kidneys. Their cortex produces several steroid hormones, of which the glucocorticoid cortisol, the mineral corticoid aldosterone, and the sexual hormone DHEA are important. Zona glomerulosa. The zona glomerulosa is the outermost layer of the adrenal cortex. It produces aldosterone and is released in response to angiotensin II, which causes reabsorption of sodium and excretion of potassium and hydrogen. Aldosterone feedback loop. Increase in potassium in the blood stimulates the zona glomerulosa to secrete aldosterone, which targets the kidneys. This increases the absorption of sodium in water and increases excretion of potassium. This leads to sodium and potassium levels to normalize in the blood, and an increase in blood volume and blood pressure occurs. Zona fasciculata. The zona fasciculata produces cortisol. This causes increased glucose metabolism in the body, enhances appetite, and suppresses synthesis of ACTH. Cortisol feedback loop. Normally, the cortisol feedback loop inhibits the secretion of ACTH and CRH. Less CRH secretion leads to less ACTH secretion, which leads to less stimulation of cortisol secretion by cells of the zona fasciculata of the adrenal cortex. Innermost layer. Zona reticularis. The zona reticularis produces androgens. These cause secondary sex characteristics to develop in males and females.
Pathophysiology. In Addison's, all the layers of the adrenal cortex are being destroyed. In the first layer, the destruction of the zona glomerulosa leads to decrease in the hormone aldosterone. This increases in sodium excretion, which leads to excess water loss, and decrease in potassium excretions. The second layer, the zona fasciculata, leads to decrease in the hormone cortisol. This insufficiency causes homeostatic imbalance of the immune response, metabolic reactions, and decrease in release of glucose. The third layer, the zona reticularis, leads to a decrease in androgens, which leads to a lack of secondary sex characteristics of both male and females and loss of sex drive. Risk factors. Although Addison's can affect all age groups and both men and women, it is more common in women. Tuberculosis puts you at a risk 10 to 15% more. Possessing another autoimmune disorder also puts you at risk for developing Addison's disease. Symptoms. Hyperpigmentation of the skin is because of the decrease of cortisol, which leads to an increase in ACTH. Low blood pressure is because of the insufficient hormone production of aldosterone that helps maintain the blood pressure and balances sodium-potassium in the blood. Concepts. Proteins. The genes specifically affecting the autoimmune reaction are called the hemoleukocyte antigen, HLA. These help the immune system distinguish between the body's own proteins and proteins made by foreign invaders. In Addison's disease, the immune response is triggered by the normal adrenal gland protein called 21-hydroxylase. This protein plays an important part in producing certain hormones in the adrenal glands. When the destruction of the adrenal gland occurs, adrenocortical cells release the protein 21-hydroxylase, which cause antigen-presenting dendritic cells to signal cytotoxic T cells, CD4 and CD8, as well as macrophages and B cells. B cells make antibodies. This all stimulates the immune response in the body and goes on to destroy more adrenocortical cells. Cell homeostasis. Insufficient hormone production by all three layers of the adrenal gland is what disrupts homeostasis. Deficiency of cortisol signals the pituitary gland to release more ACTH, which causes the hyperpigmentation of the skin. Deficiency of the hormone aldosterone leads to lower levels of sodium and higher levels of potassium, which affects the body negatively. This causes fatigue and nausea in the body. Insufficiency of DHEA results in hair loss and loss of sex drive. Cell membrane. In Addison's, hyperkalemia occurs in the cell membrane. Because of the insufficiency of aldosterone, potassium is not being excreted. The excess amount of potassium retained in the cell membrane causes irregular heartbeat and nausea, as well as sodium is not being reabsorbed into the blood, leading to hyponatremia. Water is attracted to sodium, which follows into the cell, causing the overcrowding and water loss. Treatment. The doctor puts Mary through many tests, including ACTH stimulation test and CRH test. Mary is diagnosed with Addison's disease. The treatment for Mary is substituting the hormones that are not being produced properly. Medications such as hydrocortisone and fludrocortisone are used to maintain the deficit Mary has.